So welcome everyone to Drug Law Reform with Fiona Patten. I'm Marianne Cosgrove, I'm CEO of Humanists Australia. I'm speaking to you today from Ngunnawal and Ngambri country, and I recognise that sovereignty was never ceded. I pay my respects to their elders, past and present, and recognise their continuing connection to culture and country. I acknowledge and pay my respects to any Aboriginal and Torres Strait Islander people here today. I'll listen to your voices, do my best to understand your stories and lived experiences, and speak up when I see you suffering from injustice. Our speaker today is Fiona Patten, Australian Humanist of the Year 2020 and former member of the Victoria's Parliament and founder of the Reason Party. Fiona brings a wealth of experience and expertise to the table. Known for her bold advocacy and dedication to evidence-based policy. Excuse me, we've got someone coming in. Evidence-based policy. Fiona has been at the forefront of the push for progressive drug legislation. Her insights are informed by years of campaigning, legislative work, and engagement with stakeholders from diverse backgrounds. As an extremely active and effective MP, Fiona has been successful in raising the following issues, which have resulted in either a parliamentary inquiry or legislative action. Safe exclusion zones around abortion clinics, Australia's largest public inquiry into drug law reform, the establishment of online e-petitions to Parliament, transforming the transport industry through ride-sharing legislation, a trial for Victoria's first medically supervised injecting centre, voluntary assisted dying legislation, and the spent convictions scheme. Please, everyone, give a warm welcome to Fiona Patten.
Thank you. Thank you, Marianne, and thanks everyone for coming along. I apologise if I'm it's such a big issue, it's such a big subject, drug law reform. I was grappling with where I would start on this, but I'll try and cover some small areas and then we can discuss more broadly if people are interested. If I could first acknowledge that I am on Wurundjeri land of the Kulin, Wurundjeri Woiwurrung land of the Kulin Nation. And I'd also like to pay respects and acknowledge that this land was never ceded. I also want to acknowledge that our prohibition on drugs, our draconian drug laws have impacted our Aboriginal brothers and sisters more than the rest of the population. You know, we look at our prison systems, and you know, close on 20% of the women in prison in Victoria are Aboriginal, and they are completely overrepresented in the men's prisons as well, and sadly in our juvenile justice system. So hopefully in Victoria, where we're going through a treaty process and a truth-telling process, we may start to see that change. As Marianne mentioned, I was part of one of the biggest inquiries into drug law reform, and in fact my computer is for this session is actually sitting on the report, so it's the right height of a tome to enable, you know, good eye level with my camera on my computer. But it's, while we've written a lot about it, we've talked a lot about it, we've acknowledged so many times that we have an issue with our drug, well, not maybe with our drug use, but with our drug laws. We've sadly done very little about it. And today I thought I would just try and cover off some thoughts on broad thoughts on cannabis, heroin, and nicotine, because nicotine is now an illicit drug in Australia, in certain formats and in certain forms. So I think, you know, we seem to be not learning from the mistakes of the past, and you know, millions, not, you know, when we think of Australia, where we arrest tens of thousands of people for using drugs, organized crime makes billions of dollars from drugs, but when we think about overseas, thousands of people are killed because of drugs every day. Now, whether they're prosecuted by the under draconian drug laws, or they're killed as part of the drug industry in many developing countries. But millions of people around the world are affected and impacted by the laws in their own country, but also by the laws in countries like Australia, where we import a lot of the drugs that are consumed here, and therefore further fund the illicit industries in those countries that have caused so much death and despair in those countries. Yeah, but there was times when we were hopeful, and I was reflecting on this, and I think it's a little known fact, but um, a former Prime Minister, John Gorton, who I don't think anyone would rank as one of our best prime ministers by any means. However, when he left Parliament, he became a patron for the first cannabis law reform organisation in Australia, and it was called Normal. And so we had a prime minister as a patron of a drug law reform organisation. And I think back then it was the 70s. My partner went to the first Aquarius Festival up in Nimbin in the early 1973. And I think everyone imagined that the world was going to change and that drug law reform was going to change. And, we would see certainly cannabis and other drugs become legalized or at least decriminalized. Even back then, Prime Minister John Gorton, and not when he was Prime Minister, of course, they're always much better when they leave Parliament, it seems. It's the same with the police, the number of ex-police commissioners that have seen the light, and are calling for drug law reform, a light they never saw when they were actually in their jobs. But certainly John Gorton was also an advocate for providing heroin to people who use heroin. And in the 1980s, when I first probably started to get involved in politics and advocacy, again, there was a moment of hope. Now, it was hope that was born out of despair. I mean, this was the 1980s. This was HIV and AIDS, and we were seeing people, many people dying, not only dying but being incredibly discriminated against, and our governments at that time, our government was brave. We had a health minister, Minister Blewett, and we had a shadow health minister, Peter Boehm, who were in lockstep in saying we need to reduce the harm to prevent the transmission of HIV and AIDS. So that was when Australia started leading and started introducing needle exchanges. I used to volunteer on a mobile needle exchange in Canberra. And that was because we knew that while using drugs was not harmless and certainly could be very harmful, sharing a needle was something that we could minimize the harm from by providing people with clean needles, by providing people with information and education about how to hopefully use their drugs more safely. It was a time when we had peer educators, when the government was listening to the experts and listening to the people who were using drugs. The government funded the Australian Intravenous Drug Users League, the AVIL. We saw a real change, and I think everyone thought that we would see greater change that would be born out of that. Sadly, we didn't. We certainly saw, we saw methadone become much more freely available during that time as well, because as we recognized that once we were connecting with people who were using drugs and were harming themselves as a result of that drug use, that we could offer options because we were in contact with them. So we could start providing information about methadone or Suboxone, and we could start seeing people move into those areas. But we haven't done a lot since then. So yes, we have methadone out there. Yes, we still have needle exchanges. We have some peer organizations, but not much more. And as we moved into the 1990s, and we were doing a great job. I mean, I think Australia's very proactive recognition of harm minimization, particularly around drug use, but also around a whole range of issues such as sex work, sex work and really promoting safer sex, meant that Australia was not as impacted by HIV and AIDS as other jurisdictions were, and as we could have. As part of that, there was a chief minister in the ACT, a Liberal member, Kate Carnell, who posed a proposal for a heroin trial at that stage. So it was really, how can we break that nexus between drug use and crime? How can we bring people in who are using heroin? And when people are using or misusing drugs or have an addiction to drugs, there's always an underlying issue. It's not that they just, one day woke up and went, what would be fun is using heroin till the fact that to the point that it impacts my life so terribly that I can't hold down a job, keep my family or whatever. That's not how it happened. So Kate, in her wisdom, wanted to do a heroin trial, supported by every single health minister around the country. Unfortunately, John Howard had formed a bromance with Major General Waters from the Salvation Army. And whatever the Major said was what Prime Minister Howard did. So we saw abstinence being rolled back into our drug education. We saw abstinence being rolled back into the programs that were being funded to assist people around drug use. We saw the Just Say No campaigns of Nancy Reagan being moved back into Australia. And we really saw a lot of things go backwards. We also saw our hepatitis C infections start to skyrocket during the 1990s. It wasn't all bad. We certainly had, wonderful, and while he was a minister of a church, he was a true humanist in Father Ted Noffs in New South Wales, who, along with some Catholic nuns, decided that they could not hand someone a needle and send them down an alley and not know whether they would live or die. So they actually set up the first illegal injecting room it wasn't actually the first. It was the first. They set up the first one. It was closed down by then Bishop Pell. He pulled the nuns out and refused to allow any of their property to be used. Ted Noffs tried to do what he could do with that, but I think Ted was actually using some property that had been owned by the Catholics. Uniting Church, again, in a very humanist way, tried to open a centre down here. And in the 1990s, we were seeing the Herald Sun, not the most progressive newspaper or not even the most humanist newspaper, was running the road toll and the heroin, the deaths by road accidents and the deaths by heroin on the same page. So you could compare the numbers and you could see that, just as many people were dying from heroin overdoses as were dying on our roads. I'm sad to report that now twice as many people in Australia die from an overdose than die on our roads. So our drug toll, particularly to opioids, is double our road toll. And yet you never hear a politician going, let's aim towards zero. We don't want to see a single person die from drugs. We talk about towards zero in stopping people from dying on our roads, but we have never talked about this as far as people dying due to drug use. Meanwhile, in Switzerland, they're giving away heroin to people who use heroin, and they continue to do that. I don't know what the actual name of the program is, but the acronym of it is HUG, HUG. And when I visited the program, that's exactly what it felt like. And I'll talk about that a little bit more in a minute. But it was exactly that, and when when in the 1990s we were trying to get this an injecting room up in Melbourne, and everyone understood that it was the right thing to do. You know, the Premier Kennett said, this is the right thing to do. We will do it. I will open the centre, and it was going to be in Lonsdale Street, and it was going to be run by the Uniting Church there. And they, again, they were running an overdose prevention unit in their car park. Volunteers would go to the car park there and invite people who wanted to inject drugs in the city to come to that car park, where they would try and help people if they accidentally overdosed. So you saw this real humanity there coming out. And anyway, we had Jeff Kennett and Steve Brack saying, you know, I'll open one. No, I'll open 5. In the end, none were opened, of course. And then we saw in 2001, Bob Carr did open one after a drug summit in New South Wales. Bob Carr says now and today that it was the best thing that he did while he was in politics. That it was the one thing he knew that he could see fundamentally not only save people's lives, but change people's lives. And I'm sure, you know, Bob Carr, I mean, he was a foreign minister. There was many things that he achieved, but to him, that is one of his biggest achievements. And he says it himself. In 2017, we saw the supervised injecting room open in Melbourne. Now, while heroin kills a lot of people, it's actually other opioids that kill more. And we have it. We don't have the opioid epidemics that we're seeing in the United States, that we're seeing in Canada. And we haven't seen the emergence of some of the synthetic opioids like fentanyl coming into Australia, but it's happening. And we're starting to see changes in the heroin market. I mean, in Australia, heroin has always been very easy to get. I mean, it was banned, it was prohibited nationally, and it was prohibited as a drug, as a prescribed drug in 1953. And I can tell you, you read the Hansard and the statements from the AMA, all of them opposed the prohibition of heroin in 1953 because it was a very effective medicine. But no one has had trouble getting heroin in Australia, and in particular in Melbourne. We have a very good conduit for heroin coming straight down from our neighbours in Myanmar and Thailand. We're also starting to see some of the synthetic opioids that are coming out of China starting to flow back down into Australia. What international experts are concerned about is that the Taliban has effectively closed down the opium industry in Afghanistan, and this has led to absolute heroin droughts throughout Europe. So they're starting to see the synthetic opioids there. What we're fearful of is that there will be a diversion from the heroin coming out of Myanmar and coming out of the Asian Golden Triangle over into Europe. That will cause a drought in Australia, and we will start seeing the entry of some of these incredibly dangerous synthetic opioids. We saw a case where one of these synthetic opioids was found in some cocaine on the Gold Coast, and I don't know if people heard, there was a 40-year-old woman. It was her birthday. She was out with friends. They got some cocaine. She took some, fell to the floor, was dead before she got to the hospital. It is so strong, these opioids, and it is so concerning. And as we know, prohibition doesn't do anything. What does happen, what does help is harm reduction. So something like the supervised injecting room, which has seen Victoria's supervised injecting room is the busiest in the world. We see close to 100,000 visits every year to that supervised injecting room. In the last 5 years, it has reversed close to 10,000 overdoses. And, those are the great, big numbers and impressive. But what it does is it provides a hug. It shows someone who has probably more than likely experienced childhood abuse, has more than likely experienced homelessness throughout their life, has more than likely experienced mental ill health, intellectual disability, other forms of disability. And here is a centre where someone cares whether they live or die. Sometimes for the very first time in a very long time. And there they are introduced to a dentist, other health areas. They get their teeth looked after. We can look after, other health issues that they're facing, whether that's mental health or other physical health needs that they have. We can start talking about housing. We can start addressing their legal issues. We can start having conversations about a pathway away from the illicit heroin that they're on, maybe onto opioid replacement therapies such as methadone or Suboxone or buprenorphine. What we're hoping to be doing soon is also having conversations around a drug called hydromorphone, which is an analog of heroin. And in the studies that have been done, particularly in Canada, heroin users cannot really tell the difference between heroin and hydromorphone. And it's provided to heroin users as an injectable, so they can come into an injecting room, and rather than having to go and break into a car and steal or steal from their families or do whatever they need to do to buy the money to get to buy their heroin, we will give it to them. And this breaks this nexus between crime and drug use, and it can be quite profound in enabling someone to start getting their lives back together. And what they found in Canada and in Switzerland and in every country that takes this approach, as people get their lives back together, their need to escape their life becomes less and less, and they can move back into their lives. So as we see, as I see people coming into the supervised injecting room, and I see this care, and I see this change in people. What I realise, and I've spoken to this with Marianne Chauncey at the Sydney Centre, is every single one of them smokes. Every single one. Now, we can look at saving their lives from heroin and from overdoses. We can help them there, but we cannot help them with their smoking. And this is smoking, as we know, kills more people in Australia than all other drugs pretty much put together. Probably separate alcohol out of that, all illicit drugs. It kills about 20,000 Australians every year. And we seem to have forgotten everything we've learned around harm minimization and harm reduction in other drugs when it comes to the harms of tobacco. Tony Abbott once said, and I don't make a habit of quoting Tony Abbott, but he once said that we may have lost the war on drugs, but it doesn't mean we shouldn't keep fighting. And what we're seeing now, I think, and I know that I'm really looking forward to having a conversation. I'm sure there will be differing views on this, but in my view, this is what's happening with vaping. We are seeing a million smokers in Australia have moved from smoking to vaping. Now, I'm not saying that vaping is harmless, and certainly in an unregulated market, you can't possibly create a safer product. However, it is without doubt safer than smoking, without doubt. And back in 1976, when we first started talking about harm reduction and tobacco harm reduction, you had Professor Mark Russell, who's one of the preeminent psychologists on addiction, said people smoke for the nicotine, but they die from the tar. And that is exactly it. It is smoking related diseases that people die from. It is not nicotine related diseases that people die from. So we've seen this, and we've seen in our Indigenous communities. I mean, Australia, reckons that we're pretty bloody good at harm reduction, and in smoking cessation, but we're not as good as other countries now. We think we are. We're resting on our laurels, but we have plateaued. We still see smoking rates in our Aboriginal communities of around 45%. If you look in our low socioeconomic communities around Australia, we see those smoking rates sitting at around 25 to 30%. We are seeing it becoming the illicit drug du jour. We've in Victoria in the last 12 months, we have seen 52 firebombs. The organized crime is getting into the tobacco industry because it is so lucrative. And in the tobacco industry, they're not necessarily getting charged with a drug crime as they would if they were dealing in heroin or cannabis or cocaine. They get caught with a tax crime. They've basically evaded tax. They've sold tobacco without providing the excise to the government. And so it's a lower risk for criminals, and there's a great market. And you go into, I can bet just pretty much every single 7-Eleven or convenience store near you will sell illicit tobacco under the counter, but they will also sell illicit vapes. The vapes that you see, that you see, or that if that we see, we're concerned about with young children getting, that we're seeing for sale. My local store, even though selling a vape is absolutely illegal in Australia and has been for a number of years, you still see them for sale in every store, everywhere, and still quite openly. Now, of course, the government's saying, let's prohibit that. And we're putting prohibitions on prohibitions. But what we're not recognizing is in jurisdictions like New Zealand, the United Kingdom, where they are regulating licensing this product, much like they did with their tobacco, they are not seeing illicit tobacco markets emerging. You're not seeing chop and firebombing in the UK or in New Zealand. What you are seeing is a steep reduction in smoking. You are seeing an increase in vaping, but for most vapers, that seems to taper off. And Sweden now is smoke-free. It is considered by the World Health Organization to be completely smoke-free, and that is because they have less than 4% smoking rates. Now, less than 5% is considered smoke-free. New Zealand will hit that goal by the end of next year, and they are doing it through vaping. They are doing it through encouraging people, smokers, to move from the dangerous nicotine supply mechanism to a not harmless nicotine supply mechanism, but a safer, and through a regulated market. Now, the government here has said, well, we're going to put it on prescription. We're going to put it into pharmacies, and people can go to their doctors and get a prescription. Now, if you are living out in Campbelltown, or you are living out in Epping in Melbourne, A, you won't get an appointment for a doctor. B, it's not a bulk billed appointment. You have to pay $89 to go and see the doctor, to get the prescription, to hopefully find a chemist that will provide it. So as far as I'm concerned, this is prohibition. In the same way as you could get alcohol in the 1920s in America if you had a prescription. I've got a facsimile of Winston Churchill's prescription for alcohol that he took with him when he was visiting the United States. So the prohibitions have created mad situations, and I'll just quickly touch on this. Because they have now banned vaping, this means that medicinal cannabis patients who have been using medicinal cannabis via a vaporizer, because they obviously don't want to smoke the cannabis, they use a vaporizer. Those vaporizers have now become illegal, unless they have cannabis in them. So if you import them with cannabis oil in them, they're not illegal. If you bring in a vaporizer that then you're an Australian company and you want to put your own medicinal cannabis that has been grown, carefully and under GMP and under licensing here in Australia, that is now illegal. So it's come to this preposterous circumstances. And with cannabis in Australia is the most widely used illegal drug, apart from tobacco, or apart from probably nicotine. More young people use cannabis now than they smoke. Smoking rates around young people are sitting around 7%. Smoking of cannabis, however, is sitting at around 25, 26%. So a young person in Australia today is far more likely to smoke a joint than they are to smoke a cigarette. And I think that is actually, well, the cigarette side, I think, is a very good thing. In Australia, about 12% of Australians regularly use cannabis. We spend $14 billion a year on cannabis. And yet every time we try to look at different laws around cannabis, we are shot down. We are seen, we see arrests, and the police will say, oh, no one gets arrested for cannabis. I'm sorry, 60,000 people in Australia in 2019, 2020 were arrested for using or possessing cannabis, not selling cannabis, not growing it, using or possessing cannabis. And this has got to change. And, we've got people from the Legalised Cannabis Party in our parliaments. We've seen bills being debated around this. I've conducted inquiries on cannabis use. There's been every expert around the country and would say that cannabis should not be an illegal substance. In the ACT, where Marianne's lucky to be, we've seen a complete law reform there, and they've got the interesting circumstance right now that if you're found with cannabis or heroin or cocaine or whatever it might be, the maximum penalty is $100. What they really want you to do is think about the health consequences, and so they provide pathways to health services if you're found using an illicit substance. However, if you got caught with nicotine if you got caught with an illicit possession of a vape in the ACT without a prescription, it's a $42,000 fine and 2 years prison. Now, the ACT Health Minister has recognised this significant anomaly and is trying to repair that. But she's facing considerable federal opposition to this because the federal government is hell-bent on trying to continue a prohibition on vaping and a prohibition on nicotine. So, I mean, what I would like to see is that we regulate the sale of nicotine. I would love to see us get rid of cigarettes because we know we know the harm that smoking does to lungs. And we know that nowadays the people that are most harmed by it are those that are least able to afford it. And it is our poorest cohorts and it is our Indigenous brothers and sisters. So we should be regulating vaping. In the UK, they run swap systems. If you're a smoker, you can go into a GP's clinic and hand over your cigarettes and get a vape. They've set up vape shops in hospitals because they know that smoking related diseases not only kill people but cost their health system an enormous amount. So we've seen them being really proactive. In Australia, if we could at very least license and control the sale of these substances, the sale of these products, ensure that they are safer products, ensure that they are sold from adult only venues, ensure that penalties for selling to minors are significant and severe and swift. Legalize cannabis, but don't do what we did with alcohol or tobacco, where we completely commercialized it. Let's go low and go slow. And I've been visiting Malta, where they have set up where you can have not-for-profit associations. So a not-for-profit association, rather like a cooperative, will grow cannabis. They will be allowed to have somewhere around 500 members. and they will be allowed to supply cannabis to those 500 members. This completely cuts out the organized crime. It completely cuts out the illicit market. It enables them to have conversations around safer cannabis use, around misuse of this substance. It enables people to have conversations around maybe the concerns about their drug use or concerns about the drugs that they're using. Spain has also been doing this through an anomaly in their legislation for decades. And we're seeing Germany about to do this. I don't think we want to go down a path like the United States, where you're seeing billboards advertising cannabis on every corner and on every highway. I think we can do something more modest, recognizing that cannabis is not harmless. It does have harms, and it should be restricted, and it should be controlled, and it should be first and foremost an adult product. I want to see people who are addicted to heroin, in that area around the Richmond supervised injecting room. 24 people died in a 400 square meter area. 24 people died. And had the centre been there then, they may not have died. But also, there are many people who can't use a centre for whatever reason. We should be giving them hydromorphone or heroin so that we can break that nexus, that they can come into a hug from us, and we can provide them with what they need and start having conversations around the underlying reasons that they are having to, escape life. And we can also break that nexus with crime. And look, in a perfect world, I think all drugs should be decriminalized and regulated. And, if adults choose to use cocaine instead of alcohol, or who might use, ayahuasca instead of tobacco, I think these are adult decisions that we should not be judging people on those decisions. What we should be able to do is to provide safety for people who do use drugs, and ensure that they're well educated, and that these drugs are well controlled, and that we can, spend our money that we spend, the billions of dollars that we spend on enforcement of people using drugs. We can spend that on educating people about drug use. We can spend that money on what we know are the underlying factors of drug use: poverty, lack of education, mental health, and that we can start investing in the areas that will make our society better, rather than focusing on the prohibition of drugs, which costs lives and costs us as a community billions and billions of dollars. Here endeth the lesson. Thank you.
So everyone, please put your hands together for Fiona Patten. Thank you so much for that really interesting talk, Fiona. I'll share my screen again. We'll move into discussion in just a moment, but I do have a couple of book recommendations that I'd like to share with people. The first is Fiona's Sex, Drugs and the Electoral Roll. And I'll put a link to this in the chat. The chat, where is it gone? There it is. And the second book that I'd recommend is Chasing the Scream by Johann Hari. This is an amazing walk through the history of the war on drugs and its impact. And it's told from the perspective of three groups of people: the drug users, the law enforcement who were prosecuting the war on drugs, and the crime lords who benefited from the war on drugs. And the whole book is a combination of stories from the perspective of those three groups of people, along with evidence and statistics from a wide range of sources. Very humanist.
Yeah, I could not concur with you more, Marianne. It is a really splendid book, and it is a beautiful read. It is such a page turner, and he sort of weaves Billie Holiday through it as well. So it's quite melodic in the way that he tells the story. It really is a magnificent book, and it's he made it when we were doing the drug law reform inquiry. he actually made a copy. He gave us a free copy as a PDF to provide to all of the members of the committee in the hope that they might read it. Sadly, they didn't.
Oh, but it's such an amazing book. It's really an excellent read.
Yeah, it really is.
All right, let us go on with presentation then. I have a little guide to discussion here. What happens in drug law reform stays in drug law reform. If someone says, oh, I was using heroin or whatever, that stays in this room. Please do not share that with anybody. We listen to each other with an open mind and an open heart. We leave space when we speak so that everybody has a fair opportunity to have their say. We avoid interrupting each other. If you have something to say and you're not getting space in which to say it, please raise your hand using the reactions in Zoom. And if you see someone has raised their hands, please stop talking so that they have an opportunity to speak. We speak respectfully to each other, even when we disagree. I will keep an eye on these rules, and I may mute your mic if I find that someone has forgotten a rule, and I'll remind people about it. All right. I will stop the recording now. I'll just finish up before I stop the recording saying if you enjoyed tonight's seminar, please, if you're not sure whether you're a humanist or not yet, check out the quiz at humanistaustralia.org/quiz. Please do, if you've enjoyed tonight's presentation, please donate to support our programs at humanistaustralia.org/donate. And if you are a humanist, we'd really appreciate your support by joining us at humanistaustralia.org/membership.